Hi, hello, welcome back. Let's see this interesting neuroradiology case today. 55-year-old female presented with headache. She also had loss of appetite and weight loss since 7 months. This is the flare image. You can see, please write down your findings. This is the diffusion image. Please write down your findings. Corresponding ADC. SW images. T2 sagittal image. This is the post-contrast image. Please write down your findings. Okay. So this is perfusion imaging. Write down your findings. This is spectroscopy. At this point, what is your diagnosis? Okay. The differential diagnosis is all accepted. The findings are heterogeneously enhancing lesion in the left parieto-temporal lobes, geno of corpus callosum on left side. There is also involvement of capsuloganglionic region, left ventricle, left temporal lobe, left cerebellum. The lesion, there are multiple lesions. There is adjacent leptomeningeal enhancement. You could also see few lesions within the ventricles. Ventricular lesions were there. So there was high perfusion on ASL in the periphery, and there was increased choline creatinine ratio. However, the choline creatinine ratio was falling within the benign range, and there is evidence of vasogenic edema at C3 and D8 vertebral levels, and there were correlated leptoenhancing lesions. So this is the flare, this is the lesion. You're able to appreciate. This is the peripheral rim of diffusion restriction, ADC high correlate is seen. And susceptibility weighted, there are very few areas of punctate hemorrhages which are seen. So these are the hyperintense areas which I was talking about. And also you can appreciate she received some marrow signal changes in the cervical vertebra. This would have been a good clue to diagnose this condition. And also you can see here, there is rind enhancement classically. There are satellite lesions adjacent to it. The lesions are also seen in temporal lobe and cerebellar parenchyma. Here, the most important finding which I would like to emphasize is this area, the area where you are able to appreciate the enhancing dural lesions. This is the ASL showing hyperfusion. So finally, the diagnosis is leptomeningeal drop metastasis from a breast carcinoma. Leptomeningeal drop metastasis is a rare but serious complication of cancer where cancer cells spread through membranes of brain and spinal cord. MRI is very important to diagnose this condition. The differential diagnosis in old age, the patient was 54-year-old. We can, for a similar picture, we can diagnose glioblastoma multiforme, ependymoma, choroid plexus carcinoma. But this case was a proven case of breast carcinoma where she already underwent a mastectomy and there was radiation given to the thorax. And you could see the cervical vertebral changes, which was related to the radiation related changes. So that was the clue there. So this is finally a drop metastasis from a breast carcinoma. And you can also see in melanoma, lung carcinoma, lymphoma, leukemia. In children, you can expect drop metastasis from medulloblastoma, pineocytoma, PNET, ependymoma, GBM, germinoma. And one interesting finding with leptomeningeal carcinomatosis, we can see in the cauda equina region, you can see something called sugar icing effect or enhancing area adjacent to the cauda equina. This is called Jakargas in German language. Thank you very much. Hope this video on leptomeningeal carcinomatosis was useful for you.